My name is Dr. Navalgund. I'm an interventional pain management physician, and I have both a private practice as well as an academic practice. I've been using V-Loc since 2010 when I was first introduced to V-Loc by my Medtronic rep. So I currently use V-Loc for all pain management surgeries that I perform. That includes the implantation of spinal cord stimulators, the implantation of intrathecal pumps, as well as a variety of minimally invasive surgeries. One of the more devastating impacts of wound dehiscence is that the patients have to suffer through the process of coming back to their surgeon, coming back to the operating room, having a procedure repeated, or even worse, having their device explanted, which may have been providing them substantial relief. Anything I can do to prevent or even reduce the amount of wound dehiscence in my patients, I'm going to jump right at it. So V-Loc affords me the safety and security that I need and the confidence that these wounds are going to be secure. It also allows me to have my first assist or my extender do the closure and reproduce the same results that I have. Prior to using V-Loc, I spent a lot of time trying to create interrupted suture that would have equal tension across the entire wound. And it's very hard to do unless you've been doing it for years on end. With V-Loc, you can run a V-Loc suture across a wound and be confident that the tension across the wound is distributed evenly. V-Loc gives me an opportunity to speed up each of these procedures by taking away what used to be the longest part of the procedure, which was the closure. A traditional multi-layer closure could take upwards of 25 minutes to complete. The same closure with the same security, I can close with a 2-layer V-Loc closure in under 10 minutes. I'm able to do tight, secure, but also cosmetically appealing closures where patients themselves will comment and say, "This was such a clean incision, doctor. I really appreciate it." And the uniqueness of V-Loc is not just the barbs, although there is technology behind the types of barbs that V-Loc uses, but really it comes down to the elegant and streamlined design of the product that just makes it easy to use. Most ORs, ambulatory surgical centers, and hospitals stock the V-Loc suture, and many of my peers are unaware that it even exists. V-Loc particularly makes sense for me because it saves me time, but it also affords me the security and stability that I feel is important in wound closure. So when I advise my peers, I tell them, you've got to try the suture. It makes sense.